It will happen again and again and again. That's why every day when we get up, we need to be working hard for single payer so that we can prevent this kind of tragedy from ever happening again. And now, I want to switch directions for just a second and talk about our guest speakers for the night. We have two of the best single-payer advocates that I know at all, and I'm proud to call both of them my friend. First up is Roche, Executive Director of the Minnesota Nurses Association on behalf of NNU. I'm going to tell you just a little about Rose, and then I'll have her come up. I think it's unfair because I've known Rose for better than 20 years. We have worked together. We've worked in every imaginable configuration. Rose joined the Minnesota Nurses Association as Executive Director in October of 2014 after 25 years of advocating for labor movement and health care in Minnesota and California. Rose started her professional career at the Minnesota School Employees Association in St. Paul's, where she served as their executive director for some 13 years. Rose came to MNA from the California School Employees, my association, where she served as one of our field directors. And I might emphatically say that the reason she served as that field director is because we went to Minnesota and recruited her and brought her to California. Of course, we couldn't keep her there. In California, Rose was the co-chair of a single-payer San Joaquin and served as the San Joaquin Regional Coordinator for the Campaign for a Healthy California, which advocates for health care as a human right. Our organization fought for a valid initiative to establish a single-payer health care system in California, in which Rose was a part. Rose is a real labor leader and has been an unwavering advocacy for single payer. So, without further ado, give me, my friends, the kind of applause that you would have for a true labor leader. Rose, come on down.
All right, there's a few nurses in the house. Well, good evening, fellow patients. As the honored executive director of the Minnesota Nurses Association, a proud affiliate of the mighty, mighty National Nurses United, and the union that mere months ago, I want to brag a little, organized 300 incredible nurses at St. Alexius Hospital in none other than the anti-union state of North Dakota. I bring you greetings of health and solidarity from your nurses. You know, nurses have been on the front line of this movement for decades. Medicare for All is deeply personal for nurses because they see firsthand the struggles patients go through trying to get and afford their health care. Nurses watch patients decide to go without the procedures that they need, ration their prescription medications, or make the tough choices, and this literally happens, between the life-saving care they need and paying groceries or rent. Nurses' vocation is to care for their patients, but too often the cost of health care gets in the way of performing that sacred duty. Decisions about health care should be made between a patient and their nurse or doctor, not by insurance companies whose profit motive is based in denying care. Nurses just want to be able to do the profession they love and have been called and trained to do. And that's why the nurses in our union fight every day for Medicare for All. I mean, patients before profits. We're going to hear it all weekend, right? What's so hard about that? Isn't that supposed to be what a healthcare system does? Prioritize patients? The profit motive and notion that health is a commodity to be bought and sold are simply not compatible with the goal of making healthcare accessible for everyone. As we know, health doesn't operate under the basic economic theory of supply and demand because health is not a consumable good. We don't decide to have a heart attack one day because the local hospital down the street's having a sale on bypass surgery. It doesn't work that way. Health is a public good, similar to public safety and education, and should be treated as such. We also know, many of us in the room as trade unionists, that collective bargaining over health benefits is a failed strategy. It's become nothing more than a massive transfer of wealth from workers to insurance companies and pharma. It's a powerful weapon. It's a powerful weapon that's being used against workers in the class warfare struggle that we're all engaged in. And you're going to hear more about that from our sister Sarah Nelson, International President of the Flight Attendants CWA Union, in a few minutes. As Medicare for All gains traction with voters across the country, the spin knob has been turned up to high. There are two particularly egregious and quite honestly ridiculous talking points going around for those who wish to keep the status quo simply for their own selfish economic greed. One of those absurd talking points says that everyone just loves having their health care tied to their employment. You know, our benevolent employer-based insurance system. Well, after 30 years in the labor movement, I can attest to the fact that that just isn't the case. Workers don't love having employers control their health care, right? And the other scare tactic that's being used is to claim that Medicare for All is going to cause all the rural hospitals to close up shop. Like that's not happening right now under this current system? And that's because the Medicare reimbursement rates are low. Well, let me be perfectly clear about this. The only way we're going to save rural hospitals in this country is to implement Medicare for All. And that's simply because we're going to get global budgets and capital budgets that are going to ensure rural health planning is centered first and foremost on the health needs of the community, not the population density as a means for generating profit for these healthcare corporations that are running what used to be our community hospitals. It's high time, once again, that our hospitals become a community asset as opposed to a moneymaker for corporatized health care, and that's exactly what's going to happen under Medicare for All. And just to make darn sure that the public is as confused as possible about what needs to happen to truly fix our sick care system, we now have the complete co-option of Medicare for All, with Medicare Advantage for all, Medicare Extra for all, Medicare as a public option. I guess we should kind of a little bit be proud that those who prefer the fragmented status quo at least understand that the general public is ready for Medicare for All. But this co-option, it makes it critically important that we, as the core activists for Medicare for All, warn the public about these Medicare for All lookalikes. Medicare for some is a hollow proposition regardless of how it's structured. You know, Diane Archer, who is a senior advisor at Social Security Works and is going to be one of our speakers this weekend, she wrote an article in which she very clearly spelled out the problem with these proposals, and I want to quote this for you. She says, nonetheless, a number of thoughtful commentators and well-intentioned politicians are telling us that Medicare for All is not a practical approach to health care reform. These self-described pragmatists would offer Medicare as an additional option alongside commercial insurance proposing a Medicare buy-in or Medicare for some. By any measure, Medicare for some would deliver very little for the American people. At best, it would capture a fraction of the healthcare savings created under Medicare for All. It would not address the unaffordable premiums, deductibles, and coinsurance that keep millions of Americans from getting their needed health care. And it would leave tens of millions of Americans uninsured and underinsured. So too, Medicare for some does not address the most basic question about our healthcare system. Why do we trust health insurers to determine the doctors and hospitals that we see? Why should a knee replacement cost anywhere from $16,000 to $61,000? Why should Americans pay twice as much for prescription drugs as our peers in Europe and Japan? And why should our health coverage depend on where we work? Let's get real. Commercial insurance is the biggest threat to healthcare choices and our freedom to receive the healthcare that we need. No one loves Aetna, Anthem, or any other insurance company. What we love and what we need is the freedom to get care from the doctors we want to see at a price we can afford. Medicare for All guarantees all Americans access to health care with freedom to see the doctors we want throughout our lives, wherever we live, wherever we work, and whenever we are out of work. That's about as pragmatic as it gets. Right? And I say amen to that, sister. We can't keep pretending that we're going to figure out a way to make the market work for insurers at the cost of patients. We've been there, done that for over half a century, and guess what? It's not working. We don't fix a broken bone incrementally, and we can't fix our healthcare system incrementally. And on incrementalism, I'm going to quote my brother Michael Leide to say, I think this is close, Michael, incrementalism has become the weight of our time. As Dr. King said, justice delayed is justice denied. So it is that healthcare delayed is healthcare denied. And the nurses have said half a century is more than enough. Nurses are poised to be natural leaders in our fight for Medicare for all. People realize that nurses' values of caring, compassion, and community are the values that are needed now to fix our healthcare crisis. People trust nurses to be the leaders who help reshape our broken healthcare system. So it's no surprise that activists and everyday people across the country are looking to the nurses to follow their lead. Truth is, we've seen the political climate around Medicare for All shift radically over the last few years. 5 or 10 years ago, Medicare for All was considered a fringe idea, but it's rapidly becoming a core platform issue of the Democratic Party, a priority for Democratic candidates for president, and widely supported by a majority of Americans. And as that shift began to happen, nurses recognized that we needed to double and triple down on our campaigning efforts for Medicare for All. We recognize that now is the time. Now is our moment in history to cross the finish line, to make transformative change to our economy and our society, and secure one of the largest wins for working people in this country in almost a century. So that's what we've been up to. And since nurses like to do things thoroughly and do things right, we set out to determine the best approach to rapidly build the massively scaled and organized grassroots movement that we know we're going to need to win. The objective in front of us is to organize a huge number of people in virtually every community across America from all walks of life. So therefore, we've decided to use a technique called big organizing, where we open source our strategy and make it really easy for any person who wants to get involved and take on a big role in their community to be able to do so. And it's working. People have answered the call. It turns out that there are thousands of people across the country who have just been waiting to get involved in the fight and have just been waiting to be asked what to do. We're not giving them just tasks, by the way. We're asking them to take on a huge role in their community. We're asking them to lead those organizing efforts in their cities and towns and be responsible for getting other new volunteers involved. Hundreds of volunteers are working the campaign. Together, this year alone, we've organized over 1,500 canvases, knocked on over 20,000 doors, and driven over 10,000 calls into Congress. It's good work. And sure, we're organizing volunteers in progressive states like California and progressive cities like Minneapolis, but we're also organizing volunteers in states like Alabama, Indiana, Oklahoma, Iowa, Kentucky, and West Virginia. Important to do that. And almost all of them have never met a staff organizer in person. Volunteers are working directly with other volunteer organizers in their own neighborhoods and communities, everyday people just like them who want to heal our broken healthcare system. And this is how we scale our work, and this is how we win, by giving people a centralized, clear plan and a strategy to plug into and making it easy for them to get involved. The grassroots energy for passing Medicare for All is out there. We know that. People are hungry for transformative change. They're sick and tired of billionaire health insurance CEOs raking in profits while denying patients care. And they're sick and tired of an economy that prioritizes, again, profit over people. Our job is simply to tap into that energy, to find those people, ask them to join us, and give them a plan to get them started. With this plan, we're going to build the largest grassroots movement this country has seen in decades, and we're going to win Medicare for All. So, to my union brothers and sisters here tonight, it's time for all of labor to join the nurses as they lead the healthcare justice wing of the overall justice movement. Let's not pass up this opportunity. This is the civil rights issue of the 21st century. So, Princeton University professor of political economics, Uwe Reinhardt, stated, "If healthcare costs in the United States were lower, most people would probably agree that ill, low-income citizens should receive the needed healthcare that is available to better-off individuals. The problem is that our healthcare system is in danger of pricing kindness out of our souls. I can assure you, your nurses are hard at work to make sure we don't price the kindness out of our souls. So we're the warriors in this room in the righteous fight to restore our humanity, to put patients before profits, and to enact Medicare for all. Former UN Secretary General Kofi Annan said, "It is my inspiration that health finally will be seen not as a blessing to be wished for, but as a human right to be fought for." That's what your nurses are doing, rejecting the politics of fear, embracing the politics of hope and possibility in the fight for healthcare as a human right, and we are so thrilled to be in that fight with all of you. Si se puede, everybody.